Today I'm going to go through what your typical TMJ dysfunction focus treatment looks like. So what your typical TMJD focus treatment would look like is we're going to start with intraoral work right away, as long as the patient is consenting to that. If you're not comfortable with that, that's okay. We can skip that piece. It doesn't have to be a part of the treatment. Usually I have people laying on a pillow. You can go under the covers if you'd like. You can lay on top of them. That part, totally up to each patient. There's quite a few symptoms that people can experience with jaw-related issues, but the most frequent ones that I see are popping, clicking in the jaw with opening or closing, decreased range, so not being able to open quite as far as they would typically be able to open. Typical like jaw pain, tension, like right in the sides of the jaw. Usually if it's because of grinding or clenching, they usually tell me it's worse in the mornings. Headaches, migraines, those are some pretty big factors as well. People can sometimes also get a little bit of tinnitus or ear fullness. Tinnitus is ringing in the ears. It could be one or both, depending on what side's affected. Sometimes my patients are shocked that I work on both sides, because a lot of the time when they're dealing with TMJD, it's one-sided pain or tension or clicking. The reason why I always work on both sides is quite often the side of symptom isn't actually the side of dysfunction. The one thing I love the most about our TMJ is that it's the only area in our body where we have one bone and two joints. These joints can't move independently of each other. So one side is inherently going to affect the other side. So quite often what happens is we're gonna have a side of dysfunction that could look like weakness, muscle weakness. Well, then we have the other side that's working a little extra hard, and it is now creating tension, sometimes creating pain. So I'm gonna work on this side because it's the side of true dysfunction, and it needs some help as well. But then this side is feeling pain, it's experiencing clicking, what have you. It's going to need some treatment as well. So both sides, like I said, are almost always affected. It's just a matter of figuring out what side is the dysfunctional side. But at the end of the day, it's always going to be both sides that are going to be needing treatment. If you've been experiencing any symptoms of temporomandibular joint dysfunction, then I recommend booking an assessment with me so we can hopefully get to the bottom of things.